Well, now, we're in potentially difficult circumstances with this vaccination. I always repeat that around the world where alarmism continues, 99.4% of all cases are mild. Though we are told today that Cambodia is in lockdown, infection rates in Thailand and the Philippines are soaring, New Delhi and Mumbai are under curfew, Tokyo and Osaka are reportedly poised to declare new states of emergency because of infection surges that now threaten the viability of the Summer Olympics, due to start in July. Hong Kong has imposed a 2-week ban on flights from India, Pakistan and the Philippines. Hong Kong is saying that 29 of 30 new cases detected on Sunday are found to be imported. But I repeat, well over 99% of all cases are mild. Cop this, New Zealand has suspended entry for 2 weeks from all travellers from India, and we're told breathlessly today that India, from this virus, has had 178,000 deaths. The population is 1.36 billion. That is 0.13% of the population. Some leader somewhere in the world has to say the obvious. Apart from the issue of age, that is people over 70, generally testing positive is not a death sentence. But alarmism has taken charge. Here in Australia, 910 deaths. 100% of the cases are mild. 100%. There are 44 people in hospital. Admittedly, we're coming into winter and the vaccination rollout hasn't worked as was expected. We're now miles behind places like Britain and America on the level of vaccination. In fact, we're below countries like Rwanda and Bolivia. But the pace of our vaccination program has slowed since blood clot concerns prompted the shift from AstraZeneca, which was supposed to vaccinate the bulk of the population. Again, the Chief Health Officer, Paul Kelly, is saying that healthcare workers aged over 50 were rejecting the AstraZeneca vaccine. And he then said, in what can only be described as alarmist talk, that leaves large sections of the population at higher risk of contracting COVID-19 unprotected. Why doesn't the Chief Health Officer of the nation tell the nation that 99% of the cases are mild? And as for vaccine protection, earlier today we learnt that a fully vaccinated worker who cleaned planes in Auckland that had come from high-risk countries, fully vaccinated, has tested positive. Governments will only get on top of this if they tell the truth. For example, we apparently have taken delivery of 4.3 million doses of vaccines, but as of Sunday, only 1.6 million shots had been administered. So 2 out of 3 doses that have been supplied by Pfizer and AstraZeneca have not been given to people. Where are the other 2.7 million doses? Against all that, the virus in Australia is contained, as it should be. We're an island continent. Nonetheless, there are international stories about which we should know, even though it might create vaccination hesitancy. Norway's Institute of Public Health has said that Norway's death rate during coronavirus was so low that it would be more dangerous to use AstraZeneca than not at all. The head of infection control at Norway's Institute of Public Health has gone so far as to say that the risk of dying from taking the AstraZeneca vaccine will be greater than the risk of dying from the disease, especially for younger people. We have a lower per capita death rate than Norway. We're entitled to ask why this determination for everyone to have the jab. Now the Victorian government wants everyone under 50 to be vaccinated. Then we've got a federal health minister, and these people are very selective about those to whom they speak. Greg Hunt is saying, quote, vaccination alone is no guarantee that you can open up, unquote. So is government going to keep banning us from leaving the country and stopping everybody else from visiting us? Where does this end? The federal health minister is telling us that the vaccines are not 100% effective, nor do we know for how long the vaccines are effective, which the government describes as longevity. But the bloke from Auckland who's tested positive today was vaccinated. What if unknown numbers of people refuse to be vaccinated? There are millions of children at present who can't be vaccinated. Scott Morrison, as Prime Minister, is right to argue that you just can't open the borders and let people come in. But nonetheless, there are so-called experts everywhere who can't seem to give us any outline of where this government control of our lives will end. A 48-year-old New South Wales woman has died. She was injected on the 8th of April. It's the 3rd case in Australia of a death linked to vaccination. Should Australia have suspended the AstraZeneca vaccine, as Spain, Italy, Belgium and the UK have done for the under-30s? A lady dies who was injected on April 8, but the injections continue. Now we're being told of an Oxford University study which shows that the risk of severe blood clots in the brain from the virus is 8 times greater than the risk associated with being vaccinated. I can't help but feel We're only being told what government want us to hear. The Therapeutic Goods Administration seems to be warning doctors not to give the AstraZeneca jab to under 18s, but it appears as though teenagers as young as 14 have received an AstraZeneca vaccination. And we're told of individuals under the age of 18 present for vaccination, they should not be given the AstraZeneca vaccine. Still, health authorities are pleading with Australians over 50 to get vaccinated. The Chief Medical Officer, Professor Paul Kelly, is saying 4 people per million in the UK have suffered clots because of AstraZeneca, and it was a similar rate in Australia. The Australian Technical Advisory Group on Immunisation is saying that at least 1 in a million people injected with AstraZeneca will die of blood clots. Germany and Scandinavia seem to be saying the risk could be higher than that. But only 1 person has died from the virus here in 6 months. So how many will die from a vaccination program designed to protect us from a virus when the virus isn't killing us? Denmark stopped using the Oxford AstraZeneca vaccine in all age groups. Who knows what we should or shouldn't be doing? Who do we trust? Then you get the head of Pfizer saying, people will likely need a 3rd dose of this company's vaccine within a year. That's a nice way to make another packet of money. As I said last week, if ivermectin administered for only $2 a tablet will keep the virus at bay, why are we being blocked from using ivermectin? Well, Dr. Jamal Rifi is the principal of the Belmore Respiratory Clinic in Sydney. He's had to cut back staff because too few patients are turning up. And that seems to be an Australia-wide trend as the pace of the vaccination program has drastically slowed. He joins me, Dr. Rifi.